Welcome. If you're interested in mindfulness-based psychotherapy sessions via Skype for stopping anxiety and chronic depression using the techniques of mindfulness therapy, then do please look at my website and contact me and ask any questions you may have about mindfulness therapy. This particular system that I've developed over the years has proved to be very effective indeed for stopping those underlying habits that cause anxiety and depression and other common psychological, emotional problems like OCD and problems with intrusive thinking and intrusive imagery and memories. And also for work with emotional trauma. So mindfulness therapy really is a way of teaching you how to work with these underlying habits. And it's best to think of anxiety and depression as being a series of conditioned habits. They are made up of conditioned reactive habits that are easily triggered by certain triggers, whatever they may be. They could be external triggers. For example, if someone says something hurtful to you, then that would trigger internal anger, perhaps, or internal hurt, or some other emotion. It's a kind of a conditioned automatic reaction that happens. That's an example of a habit. So where there's an external cause, it could be anything that you are commonly familiar with. It could be, for example, if you take the issue of anxiety, it could be having to pay a bill, a expensive bill, and that can trigger internal anxiety. So really what causes the anxiety is not the external factor of having to pay a bill, but it's that internal habit that is blindly conditioned, and it becomes activated when those triggers are present. And that varies a great deal from person to person. Some people would react totally differently to that same trigger. So these habits are very much subjective. They are something that we acquire, we learn unconsciously through our life experience and our upbringing. So the important thing to think of here is that anxiety and depression are not illnesses, they are not medical conditions, they are simply a series of psychological habits. Internal triggers are very common. We all know what those are, mostly in the form of thoughts, beliefs, and memories. So we often get sucked into patterns of rumination and reactive thinking, habitual reactive thinking that feeds depression, for example. Or we might get sucked into chronic worry thoughts that triggers anxiety. We might remember a painful or traumatic memory, and that may trigger anxiety or depression or a host of other emotions. But they're all habits, and these habits can be changed. Once you learn how to bring conscious awareness to those habits. So that is really what mindfulness therapy is all about, and mindfulness training in general is one of bringing pure conscious awareness to see these underlying blind habits that tend to cause our suffering. So we identify these habits, we identify the triggers, and then we start learning how to change that conditioning, to break free from those habits. And the best way to do that is through mindfulness meditation, where we learn how to meditate on our anxiety or depression and on those particular triggers that we identified, whether it's internal as thoughts or memories, or external in the form of, for example, an interaction with another person. Whatever gets triggered, we need to illuminate that with consciousness. We need to develop a very conscious and non-reactive relationship with that emotional habit and those triggers. And this takes some training, because we're training ourselves out of a conditioned habitual reaction. So we learn to meditate on those habits, and every time we come to it with a little more consciousness, we start to break free from the habits. We become a little freer each time we bring mindfulness to bear on those habits. So that's a very important part of mindfulness meditation, is meditating on your emotional habits and on those triggers to effectively neutralize those habitual reactions, so that you are free from that conditioned anxiety or depression or anger or grief or trauma. So that's a big part of mindfulness therapy. It's really learning how to face your emotions consciously, instead of avoiding them, or instead of just acting them out. That's a very common problem. So if someone hurts us, we tend to react with anger. So that's an example of acting out. That's a form of conditioned emotional reactivity to being hurt. And the golden rule here is that any kind of reactivity simply reinforces that underlying emotion, that tendency, that habit to get hurt, for example, or to become afraid, or to become depressed. So reactivity is the real issue here, and we're learning how to overcome this blind reactivity. So that's a very important part of mindfulness therapy. If you'd like to learn more about how to apply mindfulness and mindfulness meditation for healing anxiety and depression without relying on drugs, then please reach out to me and let's schedule a Skype therapy session. So, in my opinion, as a psychotherapist, drugs and prescription medications, antidepressants and anti-anxiety medications, are not really what we want to be looking at, because in essence that's simply another form of avoidance. Those medications may provide temporary relief, but you cannot expect a medication to change those underlying habits that cause your anxiety or depression. So we must use medications very carefully and only as a last resort or a tool to help in our recovery process. But the focus must be on changing those habits. And that is the chief path of mindfulness meditation therapy, this approach that I teach online. Many people really like having their sessions online. It's much more comfortable, and of course it's much more convenient. And it's perfectly fine, as long as you can see each other. So that's why I recommend Skype or other video platform, so that you can see each other. You need to see each other in order for communication to be effective, and that's a very important part of good psychotherapy. You need good communication. You don't need to meet in person for that. You do need to see each other. So if you're interested in learning how to use mindfulness to work with your anxiety or depression or other emotional problems without relying on medications, then do please contact me and let's schedule a Skype therapy session. Thank you.